Hello, I'm Dr. Damien Lafferty, a surgical podiatrist. In this talk, I'll explain what causes ingrown toenails, how we manage them, and why some procedures fail. Ingrown toenails are one of the most common problems I see in the clinic. Many seem simple, but the underlying mechanics and the reasons for recurrence can be more complex. Most of the referrals I receive are from patients who have already had unsuccessful procedures. So I want to outline why that happens and how to achieve better outcomes. What exactly is an ingrown toenail? An ingrown toenail occurs when the edge of the nail grows into the surrounding skin. This causes inflammation, pain, and often a secondary infection. It usually affects the big toe on one or both sides. As the tissue becomes inflamed and swollen, the nail digs in further, creating a cycle that rarely resolves on its own. Many people, including some practitioners, focus on the infection, but the real problem is mechanical. The nail becomes a foreign object similar to a splinter, and the body responds by trying to break it down. Why do ingrown toenails develop? There is rarely one single cause. Common contributing factors include naturally curved nails, poor cutting technique, tight footwear, excessive moisture, repetitive trauma, or structural alignment issues such as bunions or pronation. Some patients also have scarring, thickened nails, or fungal infection that distorts the nail plate. I'll talk more about these conditions in future videos. Symptoms and progression. Early stages include tenderness, redness, and slight swelling. As the condition progresses, you may see granulation tissue and infection. In severe cases, there can be ongoing drainage, fibrotic changes, and permanent nail deformity. Pain may become quite significant because the nail is acting as a foreign body. Non-surgical management, mild or first-time cases, can be managed conservatively. This includes warm saline soaks, antiseptics, gentle lifting of the nail edge, correct cutting technique, and footwear changes. In some cases, nail bracing or cotton wick packing may help. However, once infection or deformity is chronic, conservative care is unlikely to fix the problem long term. Surgical options. Surgery aims to relieve pain and prevent recurrence. The main procedures include partial nail avulsion with phenol matrixectomy, which chemically destroys the offending nail root. Surgical wedge resection, which removes the nail border and matrix under direct vision, and total nail avulsion, which is reserved for severely damaged nails. Partial matrixectomy has a success rate of around 90 to 95% when performed correctly, but results depend heavily on technique and aftercare. I personally perform the partial phenol procedure in most cases, and I'll discuss my approach in more detail in future talks. Why ingrown toenail surgery fails. Even with good intentions, failures can occur. The most common reasons include incomplete destruction of the nail root, leading to regrowth, an incorrect diagnosis, where the pain comes from soft tissue problems rather than true ingrowth, irregular contouring, or sharp spicules left behind, post-operative infection that affects healing, or persistent external pressure from footwear or gait. Less common causes include incomplete phenol neutralization, unrecognized bone prominence, or underlying dermatological disease. A point I feel strongly about is the excessive removal of nail width. Removing too much nail can create poor cosmetic outcomes and is usually unnecessary, reducing recurrence and improving outcomes. Precise phenol application is essential. Avoid removing too much nail or elevating more nail than needed. Achieve good hemostasis for clear visibility. Educate patients about footwear, nail care, and infection prevention. Manage comorbidities such as diabetes or vascular disease, and follow up to detect early regrowth. Comfort and anesthesia. For anxious patients, we may use local anesthetic, nitrous oxide, or IV sedation for complex revisional cases. A patient should feel absolutely no pain during the procedure. I'll share more about achieving reliable anesthesia in the toe in a future video. In summary, ingrown toenails are common but highly treatable when the underlying mechanics are addressed. With accurate diagnosis, meticulous surgical technique, and proper aftercare, recurrence is rare and patients return to comfortable function quickly. These are my personal thoughts based on 30 years of experience. Thank you for listening, and I'm always happy to answer questions.